about us. Think about.
Hello. What's going on? All right. I see Roel's in the building. What's up, Roel? What's going on? D-Lynn, hello. Jamie, I see you. Let's see. Alexandra, hello. Mama T, what's up? Great to see everybody on Instagram as well. We're taking questions here and we're taking questions here. Doc will be in the building soon. Tom, what's up, my brother? I hope you got a good workout in today, man. Edna, what's going on? Edna, how did everything go with your knee? Let me know in the comments. James, hello. Good to see you. Lisa, hello. I hope you're feeling better. I hope you had a wonderful time in Hilton Head. Gosh, it's hard not to have a great time in Hilton Head this time of year, so I hope you had a blast. Jerry, hello from the UK. Katie, what's going on? So good to see you. We're going to have a wonderful show this evening. I'm looking forward to taking questions and hanging out with everybody. Those blue bands are pretty cool, Tom. Like I really dig that. Yeah, Sea Pines is the bomb. Let's see who else is with us live. Who's got questions? John, what's going on? Great to see you, John. Celeste, hello. Great to see you. Thank you for being here. Rachel, what's going on? Rachel, after you showed me that picture of Wesley, I have this picture in my head of what it's like at y'all's household during the Q&A. I think that's so cool. Say hi to the fam for me. Robbie, what's up? Okay, good. Thank you, Edna. Jill's the best. She's the absolute best at that. I'm happy you got in to see her last week. Oh, Jill's over here. Jill, what's going on? Edna's over here. Jill, it was great to see you this weekend. You were manning the booth over at Rhythm and Roots in Bristol. Anybody go to Rhythm and Roots? All right. Let's see. Real quick, I'm going to put this up. Let's see here. I'm going to put this up on Facebook and YouTube. This episode of the Common Sense MD went out today. I already got an email from Tom about this. Thank you, Tom, in advance. A little part 2 episode with nutrition coach Lucas Schmidt talking about training strong, building strength, building muscle. I have to say, he's been lifting weights more after this episode with Lucas. And, I honestly, I was in that room while they were recording. And one thing I took from it was just the importance of, resistance training and building muscle to build muscle is not a bad thing. Lucas has talked openly about kind of the way he's working out right now, which I find super, super interesting. Angie, what's going on? Abby, hello. Great to see you guys over there on Instagram. Thanks for joining us. If you have questions, I'm actually going to put this comment over there on Instagram so you guys know you can ask questions tonight. We're doing live Q&A for an hour. I'm going to put this up from the start of the show. Robin Riddle did a brand new Explain This episode on acromantia, which, if you don't know, has to do with gut health. Robin does an amazing job explaining what this is, why it might be something you want to consider. If you have questions around acromantia, go ahead and put them in the comments and let us know. Thank you, Robin, for doing that episode. I see Mama T, great question there. Oh, cool. Thank you. Fran's amazing. You're going to have such a good time. Thank you so much, Mama T on Instagram. All right, we're going to get to the show here. I hear Doc is around the corner. I see Danny's in here. Ivy and JC with Ivy's in here. Terry, hello from South Carolina. I love that question, Jay. I agree around the joint strength thing. So one thing I've noticed the less I play sports is the more my joints hurt. Zach, what's going on, man? Zach is in the building. He does all of our edits. He did a great job today on the episodes with Robin and with Doc and Lucas. Zach, thank you for being here as always, man. So good to see you. Let's see here. Who else we got? If you guys got questions, go ahead and put them in the comments. Same here. I'm going to put this up. What's going on, man?
You ready for me?
I'm ready.
Have you been working out?
I've been working out. I got a little. Tom's been inspiring me. Lucas has been in here. Tom's in the building.
Tom's a good man.
I actually got to show you his gym setup. He showed it. He sent me an email. It's cool. It's really cool.
I bet he has a heck of a gym.
Nobody
gets that big and muscular without lifting some heavy weights.
That's why you know who can use some resistance would probably be me and you. Bone don't flex.
We're more lighter weight.
Lighter weight, high rep.
Yeah.
High rep.
Ripped.
Oh man, I don't even know if I can claim
fast,
that.
Speedy.
Fast twitch.
Fast twitch muscles.
All right.
That's where I want to be.
Same. I love that, Tom. I see Wayne's in the building. Wayne, so good to see you. Thank you for being here tonight.
We got the same house.
We got the same house. Shout out to Brookhaven Farms.
I wasn't playing.
They are the meat of our dinner tonight, as most dinners. I had their chicken strips last night. I grilled.
I like the carnivore diet.
Did you know I grilled?
You grilled? Yeah.
I grilled.
Yeah, awesome.
You got to put that down a little bit. We gotta look professional here.
Yeah.
All right, here we go.
Sorry.
There we go. All right, I see Donna's in the building. Donna, what's going on? Guys, on Instagram, I'm taking questions over here too. So if you have a question for Doc, go ahead and put it in the comments. Robin's in the building. Robin, we watched your reel about 10 minutes ago on Tylenol. There's so much controversy around it. So if you want to know kind of the functional medicine outlook on it, we'll talk about it here, but watch the reel that Robin Riddle did. It's on her Instagram, which is, I love your handle, Robin, Riddle Me Healthy. Check out Riddle Me Healthy, and it's on the performance medicine.
That was a great little video.
That was super.
You couldn't say it any better.
It was perfect.
The Tylenol controversy.
Yep.
I'm like Robin. I don't like Tylenol. Never have. Number one, it doesn't work too well, in my opinion. Never had Tylenol cure your headache or help your joint when you sprain it? I never have. It never works.
I know I've probably taken it for a fever, which Robin does a great job of explaining. Kind of, the knock is that, well, what if I have a
febrile
fever?
Seizure.
Right. Of course.
For a kid, if it gets up that high, you do want to give them Tylenol, but minimal doses, and only if their fever reaches 103, 104, they're extremely uncomfortable with it, because really, when you have a virus, that's the only thing you have going for you is your own fever to fight it off.
Yeah.
Like when I had COVID, of course, I didn't treat the fever. I went in and created more heat for my body and getting in that infrared sauna.
Yep.
I heated my body up, sweated it out. I don't like to treat most fevers. For kids, you got to be careful because they can have a febrile seizure. It's pretty common, but Tylenol is an extremely toxic drug. And there are many studies, like Robin said, that can link it to autism, but of course you've got, who makes it? McNeil, O'Neill, who makes Tylenol?
Who does make Tylenol? Robin, do you know?
I think it's McNeil Labs or somebody like that.
Somebody big, I'm assuming.
Yeah, and it's usually, I'm sure they make the generic form of it too. But yeah, it's, there's many times when I worked in the ER that Tylenol overdoses would come in, and you use Mucomyst for it.
Really, Tylenol overdoses?
Yeah,
they would take it. Were they taking it for fevers?
It'll shut down your kidney. It will kill you. You take too much Tylenol, it will kill you.
That's wild.
So I'm all for, what we're doing with RFK.
Yeah,
I think there's autism. I'm convinced that it's not just one thing like Tylenol. I think it's a bunch of things. Like, I think some of the vaccines contribute. Like Robin talks about the glutathione as a detox for your body. If Tylenol depletes your glutathione, which is your main defense for detoxification some of the bad materials in, say, like a vaccine, then you're going to have problems. I've had many parents tell me their autistic child who's now in their 20s, and all they can do is walk around the block, within a week or so after vaccine schedule, they just got a dull look in their eyes and were never the same. Now, that's not going to always happen. It's rare.
Yeah.
It's getting more common, but it's something to think about.
Yeah.
I like Dr. Oz, and spread those vaccines out. Don't give them all at once. And if you don't need it, don't take it. Like, you don't need that Hep B vaccine. Unless the mom tests positive, on the first day of your life. I mean, it's horrible to do that.
And it's interesting. I know I've talked with Robin about this as well. Like, how many texts have I gotten from friends who've asked me to ask you or Robin about, hey, what should I do here? And it's controversial, but
I talked to Dr. Oz personally in Washington about this.
Yeah.
One-on-one conversation about that.
Yeah.
And he does not want his grandkids to get that Hep B vaccine on day one.
Yeah.
And I'll guarantee you, Dr. Oz is smarter than anybody here, anybody listening, anybody that he's smarter than. The guy is brilliant. He really is.
All right, guys, we are taking questions tonight. I see Integrative Physical Therapy is in the building. Thank you for being with us tonight. Lau, I see you. So good to see you guys over there on Instagram. Let's see here. I'm seeing some comments. Tom is saying that McNeil is right. Thank you, Tom. See, Robin is saying NAC can help counteract Tylenol. Thank you for that, Robin.
Yeah. That's what mucomist is. It's N-acetylcysteine.
Is it really?
When a kid came into the ER with a Tylenol overdose, that's what we gave him.
That's interesting.
And that's why they're trying to make NAC a prescription medicine. It's a great supplement, but the FDA is trying to bar it from being sold because of that. Yeah, it's crazy. But anyway.
That is wild. Okay, I see. Let's see here. I love this. I'm going to put this up here from Tom. From Mark. I had my 10-year anniversary visit with Dr. Rogers last week. 10 years later, Doc looks younger. I feel older. Ben still needs a haircut. It was great to see everyone in Kingsport. I love it, Mark. Thank you for that.
I did say Dr. Oz was the smartest person out there, but Mark ranks up there.
That Mark is right up there with him.
You're up there with Dr. Oz, Mark.
I agree. It's
been a pleasure treating you and knowing you. You're always great.
Mark, we love you, brother. All right, we are getting back in here. I see Carter's in the building. Carter, what is going on? Great to see you. Connie Lynn, hello. If you have questions, go ahead and put them in the comments. We did not get questions to email throughout the week, and if I missed it, I apologize. Ping me somehow, and we'll make sure I get you on the show, even if you want to be anonymous.
How do you ping somebody?
I don't know. I just kind of made that word
ping
up.
Me.
It sounded
like
right.
Drug dealer.
Is pinging me is that the wrong?
I don't think that makes sense. Ping me.
Ping me. It made sense as I was saying it. I was thinking
drinking.
I was thinking ping me as in message us.
Ring me. I've heard ring me.
Ping me, guys. Back me up here. I think ping me is a social media term. All right, let's get going here. Favorite 5, I see you. Great to see everybody over here on Instagram. If y'all have questions, put them in the comments. Let's see where we're at. See if we have any yet. If not, we'll keep riffing. Jay's got a great question here. Jay's saying, I think joint strength is king. What is the best way to strengthen joints?
Keep your bones strong for one thing, and really through muscle strength. I mean, you can't really make a ligament or a tendon larger like you can a muscle. But if you stretch right, you take creatine, you take collagen, you're going to strengthen your joints. And the best way to keep a joint healthy, and believe me, I know this because I'm 70 years old, my knees are starting to bother me. And I think the best way to do it is like on your knee, to keep your VMO, your vastus medialis oblique, strong. That is the key to knee health. It's that little muscle on the inside of the top of your knee. So if you keep that strong, your knee is going to be stable. But if you let that thing go and atrophy, then you're gonna have joint problems. I mean, we're all kind of deteriorating in a way, with age. But in our practice, that's what we do. We use hormones to keep your, testosterone. That is key in keeping your joints healthy. That's why a lot of people I put on testosterone, male or female, their joints feel better. They don't ache as much.
I would think joints, I would think bone instead of joints, but joints as well.
Both. I mean, your joint is bone, muscle, tendon, ligament, cartilage.
Okay.
So you also need to support it with collagen. You need to support it with a lot of water.
Yeah.
Your joints need to be hydrated, especially your back joints. Your back's a joint as well. And when it gets immobile is when you start having all the problems. So motion is lotion. Keep moving, do some strength training, take your hormones or look at them for sure. And do all the supplements that you need. I like MSM, as you know. I like curcumin. I think that's very important for joint health.
I saw you just take creatine before the show. Is that something that
I have a little daily cocktail? I just pumped a little iron, as you know. You saw me in there. What are you laughing at?
Oh,
You look weak or something?
No, you're getting on me about ping me, and you're saying pumped iron.
Yeah, pumped iron, right back there.
I don't know if we can call that pumping iron. I think we can call that resistance training.
That's what Arnold calls it.
This is Ike's with us.
I went to the Arnold Classic one year just to watch, not to participate.
Did you really?
No. It's in Columbus, Ohio.
Jay, does that help? There's a lot of stuff there, and one I think that's a concern of all of us is keeping our joints strong. But it sounds to me that by doing all the stuff around muscle building muscle, aging well, it kind of helps your joints as well.
It does. Not getting too overweight on your knees, not running marathons. I don't think that's good for your joints personally.
Right.
Maybe if you're a Kenyan or an Ethiopian or you're young, but as you get older, you don't want to pound your joints into the pavement.
Yeah.
I just don't believe in it.
You
learn how to sprint, not jog, or walk fast.
Yeah.
Walking fast is as good as running.
I agree. All right, we're going to keep moving, guys. Thank you, Jay, for getting the show kicked off. We are going to keep moving. I'm going to put this up for Roel. I want to give Roel's wife a shout out. I'm so glad you're here. Can we get a name, Roel?
You're working out. I love that.
Can we get a name for Roel's wife? I want to give her a shout out down there.
We got a dog up here.
Yeah. Come on, Ike.
Ike wants to get on the TV.
Okay, let's keep moving. See where I'm at. Let's see. Let's get to D-Lynn. Thank you, D-Lynn. I'm giving the hubby 60 milligrams ivermectin for the kidney cancer. Surgery is March. Do I need to add fenbendazole? I don't want to push if not needed. Cancer is small on a cyst/tumor.
Number one, he'll do great. And that's what, if you had to have a cancer, you'd want a cancer of the kidney that was incidentally discovered, or you'd want a thyroid cancer. Those are two that are very curable, unless you get them too late. It doesn't sound like that's the case, but that's a good dose of ivermectin. Usually 1 milligram per kg is what I use. But I would take Fenben too. I just would. I'd probably do the ivermectin 6 days a week, and I do the fenbendazole every other day.
All right, D-Lynn, thank you for that question. We're thinking about your husband.
On the Fenben 222 milligrams.
222.
And I'll also, of course, give him the curcumin. I give him melatonin, milk thistle, CBD, all that stuff, and an aspirin, not before the surgery, but long-term 81 milligram aspirin. There's a lot of things you can do. Vitamin C, of course, a lot of anti-cancer things you can do.
D-Lynn, let me know in the comments if that helps. Joy in the building. Joy, I see you. I love you so much. Thank you for being in here. So good to see you. I'm going to put this up from Carter here. 2.5 scoops is recommended dose of the Dr. Rogers creatine, I'm assuming. Carter, thank you, Carter, for that.
It has HMB in there as well.
Yep. And I'm going to put this up from Robin. Incline speed walking for the win. Just finished mine. That's amazing. One thing I'm seeing in the neighborhood is there's a lot of people walking with weighted vests on.
Saw it today.
Yeah, I've seen a couple people do that regularly, and I think they call it rucking. And I'm assuming that's good for health in general.
I think it's good for you.
Yeah.
You know, you got to be careful. If you have back or knee problems, you could overload it. But in general, for a healthy person, it's great.
Let's get over here to Instagram. Donna is asking, what dose do you consider microdosing with compounded Zepbound to maintain weight loss? This is a great question, Donna. What's your thoughts on this?
Like I told you before, I do the microdosing of tirzepatide, which is a generic classification for Zepbound. And again, I don't do it for weight loss or diabetes. I do it for longevity, inflammation, prevention. I just take 0.75 milligrams. You know, it's a tiny, tiny dose that lasts you forever, keep in your fridge. But for most people, it's, 1 milligram.
Yeah.
The starting dose, if you're taking it for weight loss or diabetes, is going to be 2.5, working your way all the way to 15. But so it's a microdose. It's a truly microdose. 0.75 or 1, it's really probably easier to do 1 milligram.
All right. Donna, does that help? Let me know in the comments on Instagram if we need to clarify anything there. Let's keep moving. Thank you, guys. Let's get to Jessica. Jessica, thank you for being with us. Any recommendations for treating costochondritis? And I hope I pronounced
that just exactly right.
There we go. There we go.
Yeah, that's a painful inflammation between your ribs. And it's painful. It can last for a long time. Of course, you can use anti-inflammatories. You can use heat if it's chronic. You can use ice if it's acute. I keep talking about DMSO, and I'm playing around with some of the different formulations.
And you keep saying you're going to do a podcast on it.
I am. I'm going to do one. I'm kind of.
I know you're wanting to go really deep on that one, and there's a lot to it.
I'm experimenting with it myself.
Yeah. With
different forms. I've ordered a bunch of it. I've already gotten it in and used a little bit of it, and that'd probably be a real good treatment to a topical treatment. But yeah, it's a toughie because you've basically probably torn some of the cartilage between your ribs, and it takes a while to heal. It really does. BPC 157 is the peptide that I like for that too. So
BPC 157, and would that be oral or injectable for this type of thing?
I think injectable works better for that kind of thing. Okay. Oral helps. I do take oral as well, but oral is great, mostly for the gut.
Okay. Jessica, I hope that helps. Thank you so much for being with us. Real quick, do we have any first-time listeners, joiners of the live Q&A? Let me know in the comments. Let me know where you're from. Would love to say hello. I'm going to put this out real quick because I think this is funny. Anybody ever use the term beat me? Send me a beep.
Call me, beat me.
That's an old term.
I remember that one, yeah.
Beat me.
Yeah, but not ping me.
Ping me.
What's a ping?
Ping is like a,
It's when you ping, when you're trying to find something, a location.
You could, yeah. That's sending.
I need to ping somebody to find their location.
No, it's sending a pin. Pin you. I think.
I think it's ping.
Are we ping or pin, guys?
I think it's pinging to find out a location.
We're you know what? We've got the whole hour. We're gonna
heard of a trilateral angulization?
No. All right, we're gonna keep answering questions, guys. If y'all have a question, go ahead and put in the comments. I'm putting this up from Roel. I believe that a workout sled is a very helpful and underrated tool in the gym. I agree.
You're not kidding. You're not kidding.
I agree. All right, let's keep moving. Let's go to Wayne. And Joy, did we answer the creatine question for you? Let me know in the comments around creatine.
I think Carter answered.
Carter answered. Okay. Been on Mounjaro for 9 months now and losing the appetite suppression. Okay. Added small amount of cagrilintide, but goodness, the fatigue was intense. But boy, does it work, Doc.
Man, I haven't tried that.
Any experience?
No.
That's interesting.
Let me know how that works for you. Yeah, sometimes you may get a little tolerant to Mounjaro, and sometimes that's just expected. So what I do is tell people to take a break from it. and do more of a keto carnivore type diet. But I need to kind of experiment with that a little bit and see. Interesting.
Wayne, you got to keep us updated with that. Keep us posted with how that's going. That's interesting. So felt like a plateau a little bit, or started to feel a little more hungry. And this is with Mounjaro. That's interesting.
The new one that's coming out that everybody's probably going to love, it's not FDA approved yet, is retatrutide. Called Triple G. And that it's kind of similar, I think.
Wayne, thank you so much for the comment. Yes, you can. Yeah. Wherever Ike went, I don't know where Ike went. Tabitha, I see you. So good to see you. Let's see here.
Tabitha, are you eating burgers again tonight? Grass-fed burgers from Brookhaven. That's what I want tonight.
There we go. It doesn't get any better. I see Connie Lynn's on the carnivore diet lifestyle. I love it.
No bun.
No ketchup.
Leave the bun out. Yeah, probably leave the ketchup out. At least get the organic ketchup with no sugar in it.
There you go. I'm gonna put this up. I hope I'm pronouncing your name correctly. Elvira. Elvira is in the building, and I believe they have a question. Thank you for being with us. Ivermectin will help to get rid of blastocystos. Maybe
it's possible. It's worth trying. It's very safe for that, and it'll also with Hashimoto's. Another thing you need to look into is low dose naltrexone, LDN.
LDN. Okay, Elvira. I hope that helps a little bit. Let's get to Connie Lynn. Why does collagen powder make me nauseous? Any suggestion?
Didn't you tell me it made you nauseous?
I said the creatine did.
Okay.
I thought the creatine did. It could have been something else, but man, I felt a little nauseous afterwards.
That's interesting.
Yeah.
You're not taking a GLP-1. Obviously, if you're doing that, that can make you nauseous. Some people don't mix it well enough or dilute it well enough, I think. I put collagen powder, the keto collagen, in my coffee every day, and it really mixes well. I never get nauseated with it. Try a different brand. I like the keto collagen. It won't break your fast.
Well, they're Ike.
Here's our dog. Somebody wants to pet it.
Connie Lynn, thank you so much. We got another question here on Instagram from Donna. My boyfriend is having his knee replaced in October. He has had MS since he was 19 and manages that well. Is there anything he should be doing to help prepare for this surgery? Seems he works out every day and is in good shape. What's your thoughts on this one here?
The best thing to do is be in good shape for surgery. Knee replacements require a lot of rehab in contrast to a hip replacement. The therapy afterwards is the most important thing, I think. There's some different techniques people are doing on knee replacements these days. Some of them are doing partials. Some of them put cement in there. Some of them don't. There's a lot of ways to go. But one major thing I would tell you is to put Bactroban in his nose. It's an antibacterial ointment, musopirocin. Every household should have some in it because it gets staph. It's a prescription antibacterial ointment, way better than something like triple antibiotic or Neosporin. But if you want to prevent infection, the worst thing that can happen to you after a knee surgery is to get it infected. And I've seen a few, nosocomial infections. In other words, hospital acquired, but usually it's coming from your own nose. So a lot of people will rub, starting a couple of days or a week before surgery, just rub Bactroban ointment on the inside of your nose and after surgery as well. It'll prevent staph and strep infections. So you just don't want to get infected. You want to be in as good a shape as you can, which sounds like he is. He works out and all. And you just don't want to get infected. Yeah, is the main thing I would look at. Make sure he hydrates, and he'll do fine. And afterwards, really works on the rehab. Those are the things I would focus on the knee.
Donna, let me know in the comments if that helps. It's such a great question. I see naturally Ashley's in here. Daryl, what's going on, guys? Great to see you. I'm going to put this up from YouTube. From Jerry in the UK. I've had full lymph node clearance and I've got an insect bite mosquitoes with no immune system on my arm, which will struggle. What can help naturally? Will it heal? Let's see if I'm understanding that correctly, Jerry. So we've got
She had surgery.
Insect bite.
Got that over with.
Insect bite, immune system's down. How can we help this naturally heal? Is that?
Yeah. Again, I like, in your case, probably oral BPC 157. You can order it over the counter. As far as, just don't want to get it infected. The other thing I would think about doing is using some Bactroban, like I just talked about, on the inside of your nose and actually on those mosquito bites. But hopefully it'll cool down. It's a great question. I don't know if it's itching a lot or if it's really how bad it is. But if it's not improving and you think it may be infected, see a doctor for that. Because you're right, your immune system is lowered. There's no doubt about it.
Jerry, I hope that helps a little bit. It's a great question. Thank you for putting that in. Over in the UK, I see my brother Bo McGregor from our North Knoxville office. If you guys have not seen Bo, Bo is the man. Split your dose of creatine bin if you're getting GI side effects. I like that. I was taking 2.5 scoops. Maybe I should dose it back a little bit.
You have a weak stomach, don't you?
I mean, I take zinc is fine. Zinc doesn't bother me that much.
Really?
Yeah, I don't know why.
I have to take zinc with a full stomach.
Bo, thank you so much, man. I love you, man. Let's keep moving. Where are we at? Let's get to, let's see if I missed somebody. I think Lisa. There we go, Lisa. Lisa, I hope you're feeling better. I'm at I guess not. I'm at Indian Path ER. ER doc doesn't have a clue. I can barely walk, sit, or stand. He thinks it's related to the ruptured left hamstring. I personally can't see the relationship between it and what's happening now. I have deep gluteal maximus pain all over. Does this sound right? Well, we will certainly be praying for you, for Lisa. Guys, send up some prayers for Lisa here while she's in the ER. What's your thoughts on this?
Yeah, it's kind of seems like it's coming from that hamstring. I just wondered, have you seen one of the orthopedic doctors for it? I think you have. But you say you can't walk, sit, or stand. If it's in that left side, that's the most common thing that it would be. Again, you're one that should probably get some BPC 157, start using it to help you heal that up. Because that's just a terrible injury.
Yeah.
It's, unless you can surgically repair it. And then it's really hard to rehab from that. Unfortunately, I wish that hadn't happened to you. You need something to just get you out of that pain. The other thing I like for that situation is just an ice bath.
Yeah.
Just put your whole torso in an ice bath. I think that would help you tremendously.
What about Epsom salts? Would that be helpful with that as well?
Can't hurt.
Yeah.
Can't hurt. DMSO may be something that may help you too. You may be one that would benefit by oral DMSO.
Lisa, we're all praying for you. Thank you, Roel, for that. Send up some prayers for Lisa tonight, guys, as she's in the ER. Lisa, keep us posted, okay? Thank you so much for being with us, as always. Let's get to Angel here. Have you looked into circadian eating?
I had a patient yesterday talk about that. They ate kind of the opposite of, like, instead of intermittent fasting, they just ate at night, if that's what you're talking about. And during the day, they ate nothing. I guess if that's what you're talking about. You think about circadian rhythms, day, night, that type of thing. But some people do the opposite. So I'm not exactly sure. I haven't looked into that much. But if you're doing it, let us know exactly what you're doing and how it's working.
Angel, keep us posted on that. Anybody in here, anybody in the comments, have you tried circadian eating? Anybody tried that at all? So we can help out Angel here. I'm going to find, I see Connie Lynn. I misinterpreted the comment there. I'm going to find up where that was, Connie. It's around the carnivore diet, and just, I think it's more about just how to do it. What's a daily example of a carnivore day? There we go. Hold on.
Eating meat, eggs, cheese, maybe. Some carnivores will eat fruit, just berries mostly, because they're low glycemic. If you read Dr. Salandino's book called The Carnivore Code, he's started eating berries with it just for energy. Some people sometimes complain about fatigue a little bit on total carnivore, which is totally meat.
Yeah.
So you can mix dairy in there with it. You can mix eggs, any kind of meat.
So meat, eggs, if it's a modified cheese, fruits.
Yeah, non-processed cheese, that kind of thing. And you're going to mess up occasionally. You're going to eat something off of it. But for the most part, if you can stick to that, especially if you have gut problems, I think it really helps gut problems.
Connie Lynn, does that help? We need to probably do something with either Robin or Lucas around, exactly on a day-to-day basis what that looks like, because it is a bit intimidating.
It is. Not ease into it as well.
Yeah.
Don't go total carny overnight. Ease into it. That's what Lucas told me when I consulted with him.
Yeah. They'll put this up there for Lisa. Thank you, Jerry, for that. We're thinking about you, Lisa. Okay, let's go to Melanie. Thank you so much. Melanie's talking about our brand new location in Abingdon, Virginia. We're not open yet. We're open October 13th. We're taking appointments as we speak. Samantha Warren will be heading up that office in Abingdon, right off Cumming Street. So we're excited about that, Melanie. Thank you so much.
Thank you, Melanie.
Thank you so much. All right, let's see where we're at. If I can find, let's see for Jerry here. And then I see Roel. There we go. Will aloe vera help the mosquito bite to stop it itching?
Yeah, I love aloe vera. As a matter of fact, you can order DMSO with aloe vera in it. 50 to 70% DMSO, 30% aloe vera. Very effective.
Is that some OTC or?
And I like Blue Emu itch cream.
Yeah,
that's another one I like.
Yep.
Yeah, it's OTC.
Okay.
Yeah, it is.
Thank you, Jerry, for that. I hope that helps a little bit.
Ice helps too. Put some ice on it.
Ice as well. Roel, Doctor, will you make a podcast on RDW from a CBC panel?
I've talked about it a little bit. That's an interesting thing. Look at your RDW. It's something that most doctors don't even mention on your CBC. I think I talked about it a little bit, maybe last week or.
The RDW did come up. I forget what context it was in.
Yeah.
Yeah, it was for something very particular.
It's really the measure when they look at your red blood cells under a microscope. There's a number that represents the differences in the width of your red blood cells, and it stands for distribution width. And the higher that number is, the less chance you have of being healthy. You don't want an RDW over 14. So it's just an interesting thing. It has to do with misshapen red blood cells, and can lead to some clotting disturbances and earlier heart disease and that type of thing. But it's just an interesting little tidbit that most people don't even know about, and it's on a $5 CBC. Yeah, I will do a podcast on that.
Yeah, I love that. Thank you, Roel, for that comment. Jasmine, my SD bestie's in here. Jasmine, what's going on? So good to see you.
Jasmine.
Let's see where we're at. I see Jack's in here. Jack, what's going on, man? Great to see you. Let's see if Carter's in here. I see we're wanting some hair supplement suggestions. from Diane. Thank you, Carter, for that.
Thinning hair.
I'm assuming thinning hair. It seems Carter's on a regimen from Robin here. And let's see if I'm missing a question. If I've missed you, can you ping us at the bottom?
Ping us.
I hope everybody's doing amazing this week. We do this show every single Tuesday, 7 to 8. We answer your health and wellness questions, and you guys make this show great. So thank you for continuing to show up and hang out with us. Let's see if we got any first timers. I see Mike's in here. Amy's over in Instagram. Hello, guys. We're taking live questions for Dr. Rogers. Any brand new listeners, let us know in the comments. I see Elvira was in here with Hashimoto's or wanting to learn more about that.
For hair, I use the triple play. Ask Andy about hair. Andy has a great hair.
He does.
Usually,
his hair got so thick when he was on that
really
regimen.
He was at the point where he was even worried about it pretty badly. He was using a red light and everything. Red lights are good for your hair growth.
That's right. That's right.
But my triple play is Happy Healthy Hair, which is our hair vitamin, which I think is better than Nutrafol. And finasteride, unless you're a woman of childbearing age, can't use it. Then oral minoxidil, which is Rogaine. I just don't like it topically. So those three things, I put somebody on that this morning, that regimen.
That's interesting. They'll put this up.
Lady.
From Robin or from Carter, who's using Robin's little protocol here, the Dr. Rogers Happy Healthy Hair, and then Seeking Health's Prenatal Essentials. And if you're on Facebook, Carter has linked that, the Seeking Health Essential product that Robin has recommended. Thank you, Carter, for putting that in the comments for us. All right, let's see here. Connie Glenn has a question, I believe. Oh, Jack's got it. Jack might have the most important question of the night. Will Doc play us a tune soon?
Yeah. Hopefully it's a Beatles tune.
Yes.
Or maybe a Led Zeppelin. We'll take votes.
We need to figure out.
that good, Jack. That's the thing about it.
What guy? If you guys could, like a style of music that fits the show, let us know what that is. We'll have Doc.
I played one time, didn't I?
Yeah. What did you play? Probably Beatles. Probably Beatles.
I think I played Blackbird, maybe.
Maybe Blackbird. Connie Lynn is asking, 4th year of reclassed osteo fifth ankle break. Okay, 5 years ago. Does this concern you, Dr. Rogers? And I hope I pronounced that right. Am I pronouncing the
reclassed?
Reclassed
for osteoporosis.
Yep.
Huh. Well, yeah. I mean, hopefully you're getting your bone density scans and looking and see if you've had improvement. Some of the medicines for that aren't the greatest in the world. Reclassed is probably one of the better ones. But don't forget about hormones. Remember, estrogen is very helpful for bone structure, so is testosterone. Don't forget weight-bearing exercise. Don't forget taking D with K. I don't really think you need extra calcium personally. I think you got to get the calcium, more through your diet. I don't like to pile calcium on people, but make sure your vitamin D levels are adequate and use K2 and get a bone density scan and see how you're doing. But stay active. That's one of the best things you can do. So it sounds like, you haven't broken anything but one bone, hopefully, and that's 5 years ago. So it sounds like to me your bones are getting stronger. And I do see them improve on the bone scans.
Connie Lynn, thank you for that question. I hope that helps a little bit. I see taking those. Okay. So taking those patients at your clinic. Yes, keep D at 80. Okay.
Yeah. Okay. Great.
Perfect.
You're doing perfect. Get a bone scan every 2 years just to see.
Let's see here. I see Amy's question. Thank you, Amy. I see you, Kendra. What's going on, Kendra? Does Dr. Rogers offer any kind of ovarian cancer screening? And if not, whether he might consider it. We lost a wonderful mom from the Colonial Heights community Sunday after 2 years of diagnosis. We're so sorry, Amy. What's your thoughts on this? I hope I asked that correctly.
Yeah, there's a blood test called the CA-125 that will run sometimes. In my clinic, I don't do a lot of genetic testing, but certainly you can get some fairly good cancer genetic screens. That's going to be big in the future. I just haven't done it yet because I want to make sure that the technology is kind of a little bit more predictive than it is right now. But certainly I run a CA-125 quite a bit. They say, well, it's not a screening, it's for following ovarian cancer, but certainly I would run it if a first degree relative had ovarian cancer. And I would also probably do a scan of your ovaries, just a screening. You can certainly, the newest thing besides genetic testing is getting a total body MRI, and they're now reasonable. I don't know anybody that does them in the Tri-Cities yet, but in Atlanta is where I usually send people.
We've talked about that a little bit, some of these, genetic screenings and maybe even the full body MRI. A lot of it's like, how do you go over the interpretation of it? Does it cause more fear than necessary? You got to be kind of careful.
But there's certain things like ovarian cancer that are pretty asymptomatic until it's kind of late in the game.
Yeah.
Same thing with pancreatic. Certainly there's preventive measures as well. I think an 81 milligram aspirin is very anti-cancer. I think ivermectin is as well.
Amy, thank you for that question. I hope that helps. Let me know in the comments if that helped a little bit. I'm going to let's see here. I saw a question come in. Let's get to Tanya. Okay, Tanya, thank you so much. Will it help to take more than 5 milligrams of creatine taking after lifting and for brain health?
Yeah, a lot of new studies show that. I listened to a great podcast 2 or 3 weeks ago on that very subject. And it seems the takeaway from that was that 5 milligram for muscles, 8 to 10 for bones, and 10 to 20 for brain. So certainly for people that have early dementia, that's a great thing to get them on, is higher dose creatine. And again, it shouldn't affect your kidneys. If I was getting on a high dose like 20, I'd keep an eye on my metabolic panels like you would anyway, but which is blood tests for electrolytes, kidney and renal function, or kidney and liver function. But yeah, I think so. There's a lot of stuff you can do for brain health. Nicotine patches, methylene blue. There's a lot of kind of things, creative things you can do. And even I've had some dementia patients that I've put on stimulants like Adderall, Provigil, and it helps some. Certainly helps better than Aricept or Namenda, which to me are not helpful.
Tanya, thank you for that question. Let's get to Mark here. A friend just came back from deployment. The guys in his unit take Midol, the PMS pills for pain after training to aid in hangovers. It's got, man, this is a tough one to pronounce. I know it's Tylenol. Acetaminophen, caffeine, pyrilamine. Yeah, thoughts on this?
Man, I haven't heard of guys doing that. I'm going to have to look into that.
It's interesting.
The thing people like for hangovers too is NAC. Not only for hangovers, but for prevention of a hangover is NAC. About 1,200 milligrams works great. Ask Andy.
Yeah.
But yeah, I don't like acetaminophen, like I said. But once in a blue moon, it's probably okay. Hydration really helps too. Sometimes we'll do an IV. Seems to help a lot. Drinking a lot of water helps.
Mark, thank you for that question. Real quick, I got to give a shout out to the Ward family. My best man, my best friend, Kyle's in the building. Kyle, what's going on, man? Antonio, I hope you're probably asleep. But I love you guys. Hope you're.
He goes to bed early, doesn't he?
You got,
Antonio?
yeah, he goes to
His
bed
brother?
7:30. That's my godson.
I know. I'm saying Antonio and his brother.
And
go to
Luca,
bed early. Luca.
yeah.
Okay. Go to bed
They go to
early.
bed early. I need to get on some sort of regimen like that.
Yeah,
Sleep might be the most important thing you can do for your health.
That's what a lot of people think. That's what Brian Jones thinks.
Yes, exactly right. Kyle, I love you, brother. Thank you for being here. Let's keep going. Cody's in here. Thank you, Cody. Would you all recommend a GI map before a colonoscopy?
If you're having problems, major gut problems, I would recommend a GI map. Again, you may also need a colonoscopy to make sure you don't have an inflammatory bowel disease or even microscopic colitis, which I'm pretty sure I had following a bout of COVID a couple of years ago. And certainly I did a GI map before I got it, and Robin kind of guided me on that. And one of the things I think that helped me a lot was something you were talking about, Akkermansia.
Yeah.
And really budesonide, oral budesonide helped me a lot, along with a carnivore diet. But it took me a long time to get over that.
Akkermansia is the topic on the newest episode of Explain This. It's on our YouTube channel if you have not checked that out. Cody, thank you for the question. Let's see here. Let's see if I'm missing anybody. When are you going to come to Texas?
I'd love to come to Texas.
We'd love to be there. I love Houston. I love Texas in general. That's awesome, Wayne.
One of my best friends in medical school was a psychiatrist in Houston. What's the name of that neighborhood he lives in? It's kind of a fancy neighborhood. Wayne, if you mention it, I will tell you. But
in Houston?
Yeah. The Woods or Woodlands or maybe something like that. See, I need to come down there and visit him. I also have another very dear friend that lives in Alpine, Texas. And Dr. Ben, we need to go see him.
That's right.
Who's friends with RFK.
That's right.
And treated all those kids with measles down there.
I
did a good podcast with him.
What town is he in, Dr. Ben?
He is.
It's not Plano.
No.
It's
Lubbock. Yeah, or the
Woodlands.
The Woodlands, yeah.
The Woodlands.
Yeah. That's cool. Where he lives.
Cool. That's awesome.
They probably wouldn't even let me in that neighborhood. It's too fancy for me.
I see Connie Lynn knew too. Thank you, guys. Everybody knew the Woodlands. Okay, let's keep moving. You'll love this. Kyle's watching the Q&A right now in his sauna. He's detoxing at the moment.
Oh, that's awesome.
That's amazing. He's probably on a 24-hour fast in his sauna. I love it, man.
He's a healthy guy with good hair.
That's right. Okay, let's keep going. We got some great song recommendations here. I think I might be up to date on my questions. Roel, what podcast was this? Discuss working out. Okay. With Dr. Atia.
Yeah, that is a great podcast. I've listened to some of it. The only thing about Atia's podcast, man, they're long.
Yeah.
It takes you 3 days to listen to one of them.
Yeah. Roel, thank you for that. I think I'm up to date on my questions on Instagram. All right, real quick for the theme of the show, the music theme. I'm seeing country from Linda. I'm seeing Blackbird singing in the dead of night.
Yeah. Great song.
Beatles. It doesn't have to be perfect. Jack won't judge you. That's actually relieving. Jack won't judge you for this.
Yeah, I can play. My favorite Beatles album was my first album I ever had. It's called Rubber Soul. And the song that I like the best from it, which is a song I did learn to play on guitar, was Norwegian Wood. I even sang it. I think that may have been the song I sang.
I think it was.
Norwegian Wood.
Let's get to Tom, of course. Tom, I knew you would say heavy metal.
No, I'm not a country person. Tom's a heavy metal.
Yeah.
He's a headbanger.
Let's get to this from Jessica here. I had my hormones checked, all within normal range. However, I'm experiencing all the symptoms of perimenopause. Okay, so all hormones are within normal range. but still experiencing symptoms of perimenopause, night sweats, brain fog, hair loss, inability to lose weight, low libido, etc. Would you recommend hormone replacement even with normal labs? Slightly anemic, which I'm taking iron supplement for. Any other advice / suggestions? Well, Jessica, you're in the right spot. Thank you for this question.
I mean, if you're in perimenopause, there's no way your hormones are optimal. They may be normal, but normal with women's hormones means nothing. It absolutely means nothing. You treat symptoms, not labs. So, if you're in perimenopause, you probably have at least low progesterone and low testosterone. So I like to start out with progesterone, and I guarantee you're going to be low on that. And again, remember, when you check your hormones, it depends on the time of the month. They may be high, they may be low. So sometimes I'll even cycle progesterone in on the second half of your cycle for 10, 12 days. But there's definitely something we can help you with.
Yeah.
I like to look at the numbers, but there's no way they can be optimal. If for some reason you don't want to get on bioidentical hormones, then you can always try some over-the-counter herbal things like evening primrose oil is one of my favorites for women.
Yep.
But yeah, there's got to be something going on in there. But get a Cleveland panel too, and look at your cortisol. There's a lot of different things. It's really interesting. You should get a Cleveland panel and come see somebody like us that knows what they're doing with these hormones, and let us kind of sort it out for you. Because if you're in the perimenopausal age, you are having hormone problems. You're not optimal. Normal means nothing.
Yeah.
So
I love that. Jessica, thank you so much for this question. I know that helped more than just you. A lot of people have that very same question. So thank you for bringing it up on the show. Let's see. So Carter went to our North Knoxville office in Fountain City, and I have a feeling what this treat was.
That gluten-free cake, I haven't had it yet, but thank you for getting that for me.
Is it gluten-free?
I don't know. It's good. It came from Litton's.
Yeah, shout out to Litton's.
Yeah, once every 2 or 3 months, I'll eat a little piece of cake.
Yeah.
From, Litton's. It's really good. You should treat yourself every once in a while.
You have to.
Even though I'm a carny, I'm a Brookstone guy, or Brookhaven. I want to say Brookstone. Brookhaven guy, mostly meat, but sometimes I will indulge a little bit.
Yeah. Shout out to Litton's in Fountain City. The place is amazing. And a great chocolate cake. Okay, let's see.
I'd rather eat a great steak, though, wouldn't you?
Totally. Steak from Brookhaven. Are you kidding me?
And now that I take that little dose of tirzepatide, I just don't have a craving for sweets.
Yeah.
Even at that small a dose.
Bose told me the exact same thing. Just a very small dose of it. Wayne is saying, ever offer or have a QEEG? Just had one. It's a brain mapping and has advised me where I'm overactive and underactive, and why I'm having issues with cognition, focus, memory, anxiety. What's your thoughts on this?
We don't offer that, but there's a lady here in the Tri-Cities that does them.
Have we done a
brain
podcast
mapping?
with her?
We've done a podcast.
That's
with
right.
her.
Yeah.
I will try to put her information up.
Yeah.
But she does them, and it's just fantastic. The machine she has even kind of helps her reroute some of the neurotransmitters.
That's right.
So, and she's so nice. She's from California.
Yeah.
And I'll get
that was a great episode.
We'll somehow get you, Wayne, her information.
Wayne, remind me. I can. I'll send you that episode. It was titled something around the brain. But thank you for
It's been a while. Yeah.
for that question. It's been a couple years. Okay. I think we are. Thank you, Jessica. Thank you so much. We appreciate you watching the shows. Thank you so much, and thank you for being here tonight.
Thank you.
Let's see here. What is the med that? What is the med that makes you not crave sweets?
Tirzepatide, which is Zepbound. I do a microdose. It's that weekly shot that has so many great benefits besides weight loss and diabetic management.
Thank you, Jack, for the question.
Tirzepatide.
Connie saying, poor Ike, let him have some FaceTime. He just wants.
He's been bugging us.
He has been, just
he bugged me
wants
all night last night.
He's about to lose those privileges, isn't he?
We're trying to give him some medicine before he calms down.
All right, guys. How did we do? I believe we got to everything. Let me know in the comments, 1 to 10. How did we do, Doc? I give you a 10.
I'd give you a 10. I'd give me a 9. No, I'd give me a 5.
A 5. No, you were at least a 9.5.
I was off my game tonight.
You were at least a 9.5. Ike's down here. Thank you, Wayne. Thank you, Tom. Thank you, my brother. Yes, please do. I want to see that. All right, real quick, Common Sense MD episode. Watch it. Nutrition coach Lucas Smith goes over strength training with Doc. Brand new episode of Explain This on acromansia. We talked about it a little bit tonight. Go watch the deep dive with Robin Riddle. Thank you, Ivy and JC with Ivy. Mark, thank you, brother. Danny, thank you. Thank you, Kendra. Thank you, Amy. We appreciate all you guys on Instagram. Thank you, Jerry. All right. As you guys know, we do this every week. We do this every Tuesday, 7 to 8. I want to see all you guys back next week. We're going to hang out again, talk more health and wellness. Again, we learn as much from you guys as you learn from us. So thank you for contributing. Thank you for being here as always. And Ike finally gets some screen time. What do you think?
He's camera. Now you shouldn't have done that. You made him shy.
All right, guys.
Good night, guys.
Love you guys. We'll see you guys next week. Rachel, I love you. Carter, I love you. Connie, I love you. Ivy, thank you. I love you. All right, we're out. Where's my outro? See you guys.
Don't go away.